Okay, can you all see the title slide there? Great. So welcome again to the City Health Dashboard's virtual office hours. Thanks for joining us today. We do these monthly and they are meant to be kind of an informal way to check in with users, introduce you to the dashboard, cover kind of questions that are coming up and your use of the data and the tools within the dashboard. And today we are going back to basics, just doing a dashboard 101. We figured it was a good time just to go over all of the resources within the free City Health Dashboard to make sure that you're not missing any tools, features, or data that are available there, as we've been making updates and upgrades over time. So I am Becky Ofron. I'm the Manager of Engagement and Partnerships at the dashboard, and I'm joined by Sammy Breslin, and she'll cover most of today's overview. We are housed at NYU Langone Health within the medical school here in the Department of Population Health. And our primary funding for the project comes from the Robert Wood Johnson Foundation, and you'll see how that plays out in our approach to the social determinants of health in the data that we present on the dashboard. So just to dive in here, and before we really get started, feel free to be putting questions in the chat as they come up. We'll probably answer them as we go throughout the demo, but we'll make sure to touch on everybody's questions either throughout the presentation or afterwards. So we really created the dashboard with the goal of helping cities across the US leverage the power of data to improve health in the community. And we did that by at first launching about 35 measures of health and the drivers of health at the city level for 500 cities across the country. And over time, since 2018, we have expanded now to all cities over 50,000 population. And that covers just over 750 US cities. And you can see our coverage all across the country here for those cities that are 50,000 and larger. And stay tuned at the end to hear if you're smaller than 50,000 population, what we're trying to do about that. So we created the tool in partnership with National League of Cities, ICMA, NYU's Wagner School, to really not just present the data, but make sure that it's usable at the city level. And you can use the data in the dashboard to compare health gaps across neighborhoods, or compare your city to cities in other regions with a similar population to see how you're doing on comparable measures, and to set priorities and better target resources, whether you're in city government or community-based organizations. And just to show an example here of life expectancy and the different shapes here you're seeing are census tracts, or sometimes comparable to neighborhoods. And the life expectancy in these neighborhoods, it's just 2 miles apart. You can see how that life expectancy varies from 60 years to 80 to 68 in neighborhoods right next to each other. So as a resident or a policymaker in Columbus, Ohio, you can be really digging down into those questions to help understand what's happening in these neighborhoods. The measures, the 40 measures now in the dashboard come from national data sets, and we use really rigorous methods kind of underlying the original data collection to make sure that we're really presenting the best measures possible. We want each of the measures to reflect public health priorities and, importantly, be amenable to city level intervention. So, you know, a lot of health data is available at the state and the county level, but we really wanted city level interested parties and policymakers to be able to do something with this data. We do update the data regularly. Whenever the underlying data sets are updated, we update it on the site. And as we get into the measures, you'll see and learn more about the underlying data sets. But we do about 3 or 4 data updates a year to make sure that you're getting the most updated data. There is still always a problem with kind of public health data lags, which I'm sure you're all aware of. And we do our best to find regularly updated measures as best we can. And then the measures are balanced across 5 overarching domains. So there's a lot to look at here, but these are the domains and the full list of measures. And just to kind of orient you here, Measures listed in kind of the gold color are available at the city level and that neighborhood level or census tract, which is most of our measures at this point. And then the ones listed in dark blue are only available at the city level, not the smaller census tract level. So, you know, when most people think about health in a city, you probably think about certain health outcomes like diabetes rates, cardiovascular disease deaths. And then in terms of clinical care is where people tend to think, you know, are we getting prenatal care? How many people are uninsured? Are people getting their annual routine checkups? Things like that. But so much more goes into health. The social and economic factors, like income inequality in a city, children in poverty, school absenteeism, unemployment rates. So putting all of this together in one place it was really our goal with the dashboard, and so that you can see these health factors alongside with the socio and economic factors in one place. And it is meant to be kind of a curated list. There's certainly other measures that play into this, and we are always doing research on what measures to add to the dashboard, but we really wanted to keep it a manageable overview of what to look at. So that's where we've landed with the 40 current measures, but do know that we're always taking suggestions and ideas of what's important in your city. So here I'll turn it over to Sammy to do a full walkthrough of the dashboard.
Thank you, Becky. Let me just share my screen really quick. Okay. So this is the City Health Dashboard website. And as Becky mentioned, we are a totally free tool. So all you really need to access all of the powerful information that we provide is an internet connection, a mobile device, an iPad, a laptop, and you really have all of this available at your fingertips. And usually for these virtual office hours, we do a pretty quick demo, just taking folks through the data that we provide. But given that this is City Health Dashboard 101, we're really going back to basics and exploring a lot of the just as powerful features and resources that we provide, but the resources that might be a little bit less trafficked than the data. And especially for folks who are in smaller cities, Becky mentioned that we only have data for cities that are 50,000 and above. There's still a lot of really important and really helpful, valuable information that cities or that folks from these smaller cities can use. And so this is a great opportunity to learn about those things that we offer. So no matter what city you are in, you just enter your city into this search bar. I'm going to look at Fort Worth, Texas today. And this pulls up a metric selector that has all of the measures that Becky just showed in her previous slide, all in one place. Each of these measures, you can click into them and go into their detail pages. But if you don't know what measure you want to explore, or you want to see more of an overview or a high level snapshot, we have what we call the city overview page, which is, like the name implies, an overview. It's really high level. We provide all of the metrics that we provide in that city's performance really at a glance. So you can get just an overall sense of how your city is doing across all of our different domains and all of our measures. And I will just, sorry, I'm just trying to move this, all of our beautiful faces. If you click into all of these measures, they're hot links, so you can click into them and it pulls up just a quick, just some quick information about the measure, the description of the measure, the data source, the years of collection, and also a thumbnail of the map. And if I click here, this See Metric Detail, it pulls up just more information about that metric. And one of the great things about the dashboard is that once you have a handle on what one of these pages looks like, you understand, the entirety of the dashboard, no matter what city you're in or what metric you're looking at, all of these pages will look generally the same, except for, of course, the data that is powering those pages. So up here, we have just some information about the metric, very similar to what I just showed, but we also have the years of data that we provide. The dashboard provides multi-year data for about, I think, 30 measures, 30 out of our 40 measures. So there's a lot of multi-year data, and you can toggle between all of the different years of collection here. And we also have more metric information that explains not only what we're measuring, but also how we're measuring it, as well as why this measure matters for health. And so you can click into that here, and we call those our metric one pagers, and they're available for all of our measures. And then scrolling down the page, the dashboard is filled with visual signposts to orient users to what they're seeing and the information that we provide. We designed the site to be totally usable, understandable for a wide range of audiences, especially lay audiences. And so we provide, like I said, these visual signposts just to help you understand what you're seeing. So this scale bar here represents the range of values for a particular measure. So in Fort Worth, Texas, looking at children in poverty, the rates range from 0% to 77%. And across all of our measures, lighter colors indicate better outcomes, darker colors indicate poorer outcomes. And this blue check mark in the circle is located in the direction of those better outcomes. So for a measure like children in poverty, for example, what we're looking at here, you want less of your city's children living in poverty. So this blue check mark will be on this side of the scale. Whereas for a measure like walkability, you want more neighborhoods experiencing higher walkability. So that check mark will be on this side of the scale bar. And this blue triangle here indicates the dashboard city average. So this is the average of children in poverty across all 750 plus dashboard cities. And then this gold bar here is the city or the census tract value. So in the case of Fort Worth, Texas, 20% of Fort Worth's children were living in poverty, and that's compared to 19.3% across our dashboard city. So it's just lower than the dashboard city average. And then scrolling again down the page to, my favorite part of the dashboard, which is the city maps. And Becky showed a snapshot in her intro of a map that looked pretty similar to this in Columbus, Ohio. And so each of these, blue shapes represents a census tract or a neighborhood. And what's great about these maps is that it's really easy to see at a glance geographic patterns that may exist in your city. So just looking at this map, this snapshot, I'm noticing that neighborhoods in the southwest or southeastern, part of the city have much higher rates of children in poverty as compared to these neighborhoods in the north part of the city and maybe on the western side of the city. And each of these neighborhoods or census tracts can be clicked into and hovered, and you can get more information about the different rates. And those, those census tracts will be pulled to the side to again allow for comparisons across place. And moving along, what we call this navigation bar, we provide demographic detail for 1/3 of our measures. So in the cases of metrics where we don't provide neighborhood level data, we really try to provide that demographic data or data, the metric data broken out by race, ethnicity. Children in poverty is one case where we provide the data in both neighborhood format, but also broken out by race, ethnicity, or disaggregated by race, ethnicity. So looking at children in poverty by race, ethnicity in Fort Worth, you're able to see, these data just broken out or disaggregated in a different way. And it helps us understand, what different communities are facing, not just geographic communities, but also these racial ethnic communities. And looking at just this top example, 3.8% of the child population in Fort Worth is Asian, but 14.6% of the Asian population or the Asian child population is living in poverty or is experiencing poverty. So that is a really big disparity that we're able to see through these data. And again, you can see just the 5 major racial ethnic groups here. And while we're on the topic of demographic data, in September, or actually October, excuse me, of October of 2020, we added a whole bunch of demographic information to the dashboard. And we provide this data in a few different ways. And so you can access these data from the city overview page. So the first way that we provide demographic data is in tabular format. And so we provide both data on age for cities, but also not just those 5 major racial ethnic groups. We have a much more comprehensive list of category of those racial ethnic groups that we provide. So just looking at this table here, you can see there's this check mark, or this plus sign next to Asian, and it pulls out 3 regions that people might identify as so East Asian, South Asian, Southeast Asian, and you can see those city population percents. But as you can see, there's another plus sign that you can kind of dig even deeper into these groups and see data on the subgroup or the nationality that people identify as. So just looking here, the Chinese population versus the Japanese population and the Taiwanese population, all of these groups, yes, they all belong to the Asian racial ethnic category, but there's so much nuance there. And it's really important to provide that level of detail to help us understand just who is living in our city and how can we better communicate, advocate with those communities. And we also provide this demographic information at the neighborhood level and in map form. So if you just go to this tab, demographics by census tract, you can either choose to look at your data by age, but I'm going to look at the Hispanic population. So I can just click into Hispanic, and then a map generates on the page. And this map looks very similar to the metric map we saw for children in poverty, but the lighter green colors or the lighter green neighborhoods indicate areas where there's lower density of whatever demographic you're looking at. So in this case, Hispanic. And the darker greens, those hunter greens, indicate neighborhoods where there's a higher density of Hispanic population. And again, you can see patterns forming, patterns emerging. And I'm going to dig deeper once more, and you can see these different Hispanic subgroups that exist. And I'll just click Mexican, and now you're able to see the density of Mexican population across neighborhoods within Fort Worth. And a lot of the neighborhoods where there was a high Hispanic population also tend to have high Mexican populations as well. So again, this is just really important context for whether we're doing public health work or policy work, when we're really just making sure that we're targeting communities appropriately. And we're really proud of this data that we provide. It's very hard to calculate this data, and it's very rare to provide this data down to the neighborhood level for a lot of these subgroups. And it really sets the dashboard apart. And so then just skipping it back onto that navigation bar, as Becky mentioned, all of our data is pulled from national data sets, which allows us to compare apples to apples. And we, there's a lot of amazing work being done across cities. And, if I'm a public health, or I work for the health department in Fort Worth, Texas, perhaps there's a city that has a similar program or has a similar population that maybe I want to learn from them. Maybe they can be a peer city of mine. And I can identify those cities in a number of ways. So I could enter the city here. Let's just say I want to enter Dallas. That's that's the sister city to Fort Worth. And then Dallas's scale bar will be pulled down right here. But let's just say I don't want to compare myself to Dallas, or I don't know what city I want to compare myself to. We have the city finder where users can select filters that make sense to them and their work. So for example, I can select by location, and maybe I want to look at the adjacent states to Texas, And then maybe I'm interested in exploring cities with a similar Black population. And as I, kept clicking onto these filters or these characteristics, the city list kind of got whittled down. So now you can see there's 5 cities that meet my criteria. And so I can click into Kenner, Louisiana and Lawton, Oklahoma. And those 2 cities scale bars will be pulled down below Dallas. So you can see how poverty rates compare across these different places. And while we're on the topic of poverty, I think it's pretty clear and obvious that poverty is a very, very, very large, complex issue that is definitely not easy to solve and does not exist in a vacuum. And perhaps there's other, or not perhaps, there are 100% other issues that might be involved in poverty or connected to poverty that are useful for us to understand what's happening. So the dashboard has this metric comparison feature where we can choose any metric to compare to. So I'm interested in exploring how poverty compares to diabetes rates in Fort Worth. So you can choose diabetes, and then this map that we continue to see is pulled up, and the blue polygons or the blue shapes on the base of the map indicate children in poverty or our original metric. And the red or pink dots on top of those shapes or on top of those neighborhoods indicate the diabetes rates. And like I said before, lighter colors indicate better outcomes, darker colors, poorer outcomes. And once again, those same patterns that we were seeing in this southeastern part of the city where poverty was higher, we're also seeing higher diabetes rates. And you can hover and click into these neighborhoods to see the different estimates. And it's just really helpful to understand, if children are living in poverty, what are those other issues that they might be dealing with as well? And how do measures move together or don't move together in neighborhoods across the city? And we provide the same information in a different way through these scatter plots, where it's really easy to see a tight correlation between these 2 measures, where in the neighborhoods where there's high poverty, there also tend to be high diabetes rates. And each of these dots here indicates a census tract, and you can click into those dots to see both of the estimates. And then take action. When we built the dashboard, we really wanted to make it as actionable as possible. We didn't want people to come to this tool and see all of this data and see all of this information about their city and then be kind of forced with a now what. We wanted them to be able to really move from data to action with our tool. So we created this Take Action Center, as we call it, which it's really a treasure trove of resources. We have over 400 plus resources that are broken out into these 5 buckets. We have the what you can do, the policies and programs that you can implement in your city. And here you will see there's 21 policies and programs that we've kind of put onto the dashboard that are filtered for or targeted for children in poverty. But if you access the Take Action section from our main menu here, that will be an unfiltered list and you can add your metric. But we also have the ability to filter by audience type. If you're a local government employee or you are a business owner, there are different things available to you that you can implement in your community. And so we wanted to make sure that we provided, a vast look at what's available. And these 4 other buckets are the how you can do it. So find partners. Perhaps there's someone that we can invite to our table to help us meet our goals. Is there a United Way in my community that I can partner with or I can collaborate with to move the needle? Who are my elected officials? So we provide all of this information here. Explore strategies helps us get the work done. Are there ways that we can communicate better with our constituents? How can we advocate to our elected officials to make sure that they understand, community challenges? So all of those types of resources and tools are in this section. Find funding, pretty self-explanatory. We all know that there's never enough funding, especially for public health programs. So we provide opportunities or grant and funding opportunities, but we also provide tools to help you apply for that funding. And then measuring impact. So once we have a program or a policy in place, how can we make sure that the results that we're hoping to get actually meets what's happening on the ground and is really moving the needle for the residents that we are targeting. So we have a whole bunch of resources to help you measure your impact and evaluate your impact here. And so this is what we kind of, I do want to also mention before we get into the real nitty gritty of the other things that we provide, the dashboard allows users to download or access all of our data. And we do that in a number of ways. So the first is through these downloadable CSV files. So you can either download the full dashboard city set, or you could download data for your state, and then you can filter for your city or whatever cities you're focused on. I do want to mention that these CSV files only have the most recent year of data available, whereas our API, which is, don't ask me to explain what an API is, but if you're an experienced data user, you can access our multi-year data through the API. So that is what we cover in our standard demo. And now I want to go on to, again, those less traffic parts of the site that are super engaging and interesting, but might not be as on the radar as the data. So like I said, we have a lot of data on the website. There's a lot of information, and you're looking at a lot of this data across time. So and one of our goals when we launched the dashboard was we wanted to add to the research base about health, urban health, and the social determinants. So we have this section where we call research and reports, which is kind of a depository of all of the research that we've done, the articles or the manuscripts that we've published, and that can all be found here. So some of these are, internal things that we've done, or they are articles that are written for journals. And so you can explore those here. They kind of range across walkability. We have some research on life expectancy and segregation, broadband data. And just a note, if any of you are researchers on this call, we highly recommend using our data for research and using our data in your work to add to that research base. So you can access these reports here. We also have a whole bunch of education resources that either we've created or were created by teachers and educators in the field using dashboard data. So we have assignments aimed at middle and high school level courses, and these are two tools that we created on our end that have been used in the classroom. But we also have example assignments that undergrad and graduate level professors have shared with us, where they have used the dashboard in their work with students. Impact stories. This is a part of the site that's very near and dear to my heart. We launched this in July of 2021, so just this summer. We are always talking to cities and to users, almost on a daily, weekly, monthly basis about how they're using the dashboard. And so we have created what we call impact stories, but are small use cases or case studies of how the data has been used in a local context. So we have 9 on this page, and these impact stories run the gamut from, universities to health departments, to foundations who have used the data in their work. And I will just click one just at random. This is focused on Clifton, New Jersey, and they are in Clifton. It's a small city health department that was applying to become nationally accredited. And so you can see, all of these impact stories are formatted the same with like a challenge and an impact. And again, they're short and sweet. And they really get to, what was the problem, what was the challenge, and how was the dashboard used to meet goals, and what was the impact of using the dashboard in that local work. So you can see these here. And again, there's 9 of them. They're really broad in what they're targeting, or what these local groups were targeting. And these are just great if not only if you're a newcomer to the dashboard, even if you're experienced, just to see what's happening out there. How are other communities using the dashboard, and how can I learn from that? How can I maybe implement, that program or those data into my work? And then I'm almost done. These next couple will be pretty quick, short and sweet, but we have a pretty active blog. These are different than articles that we are publishing for a journal, but we release about a blog a month, sometimes more, but never less. These again run the gamut of being, really data focused to being focused on health equity. And it's really interesting to see what's happening around the dashboard. We also have an events page, which provides information on all the different ways that you can connect with our team. So we'll have the virtual office hours listed here, but if we're presenting at a conference or if we're presenting on a webinar and it's open to the public, we'll post those opportunities on this page. So you can see we have their virtual office hours, but we also have February virtual office hours, which I also suggest you sign up for. And then finally, partner with us. Becky mentioned that we provide data for cities 50,000 and higher, but we are always exploring new ways to bring more data into the hands of more people. So whether that means more cities, smaller cities, new geographies, adding new metrics, or any sort of customization, we are always eager to partner with folks and collaborate with groups on how to make the dashboard work for them. So there's a lot to say about this, but like I said, we have a lot of different ways we can customize the dashboard, and we invite folks to reach out to us and contact us if you're interested in exploring those potential opportunities to collaborate with. And that is it. That is all she wrote about the City Health Dashboard. In case you haven't, we also have a great newsletter. We don't spam you. But if you want to learn more or just stay updated on what's happening around the dashboard, definitely sign up for that. And you can do so at cityhealthdashboard.com/subscribe. But I will stop sharing and leave time for questions.
Amy, did you cover how to download the data?
Yes, I did.
Okay, great.
Yeah. Let me open the chat. I see there's a lot happening in the chat.
Hi, this is Tom. I'm curious, when you download the CSV files, then I've been looking for the corresponding polygons for those track groups and block groups. Where do we find those?
So the CSV file, so when you download those CSV files, it is in like an Excel spreadsheet. So it's the data that powers the website, but you have to, integrate it into a data viz platform if you want to see if you want to see like those polygons. But and if you're interested in doing additional analyses with the data, but if you're just interested in kind of having those maps available to you at will, let me share my screen one more time. I didn't do this before, but I will do it now. The dashboard allows you to download the maps and the scale bars. I don't know if that's what you meant, Becky, but I'm just realizing that we can do that now. Just give me 1 second. So this here, as it's pretty explanatory, you can download the map. I hope it works. It's sometimes hard with sharing screen, but if I click that, okay, here, let me open it. I can open up a high-res file of the map, the scale bar, and all of the relevant information, the source, the legend. And another thing that's good about these downloadable images is that if I zoom in to the map and then I download, it'll download the zoomed in image. So I don't know if that's what you were talking about, Tom, or if that's
helpful, but I'm really looking to bring it into a GIS systems. So I've gone to the census and looked to the tracks, but I'm not confident I'm getting the correct version to match the data that you're presenting.
So if you email us, Tom, I'll put our main
Okay.
email address here in the chat. Depending on what exactly you're looking for, whether if it's for a certain city or region or something, we might be able to help you with the kind of background geography files, but we don't post those generally, but we can probably help you with them.
That'd be great. Thank you.
But there are some, there's a code book and some instructions for using the downloadable data that you might find helpful in the files that comes when you download the whole, the CSVs.
Could you put a link to those cookbooks? in the
Yes.
chat?
Yeah, when you download the CSV file, there you should get a whole zip file that has a couple of different things in it. And then also on the data access page, there's kind of right at the top of the page, there's something that says start here that includes the code book.
And while we're on the topic of that, it's really easy if you are a more experienced data person, GIS person, even if you're not, I am not an experienced GIS person, but there are a lot of great platforms out there, data viz platforms that I've even been able to integrate or just kind of download or upload our CSV files into these platforms, whether it's Tableau or Data Wrapper. And it's pretty useful to see the data in that visual format and integrated with those platforms if anyone's interested in doing that as well.
Amy, I just wanted to address Robert's question in the chat, which I had mentioned early on, so we'll circle back to now, how cities less than 50,000 can use the dashboard. So Robert, you are one of the lucky ones from Millville, New Jersey, who were part of our NJHI pilot, which was the first time we added cities under 50,000. And just for others to know, because I'm sure you know, Robert, through this project, we added 10 small cities in southern New Jersey between, I think they were populations like 2,500 to 30,000. And Millville, which is a small city of about 27,000, was added during that pilot. So, so you can already access your data on the dashboard. Almost, I think, the full complement of measures are available for Millville. Yep, and Sammy just shared a little bit of that case study. So for other small cities under 50,000, we will be launching a little bit of a challenge to be announced next week, I think, but as a sneak peek, just for those folks here, we will be inviting small cities to apply to have their city added to the dashboard. So for cities under 50,000. So like Robert in Millville, to be able to have that access to the City Health dashboard data for your city, there will be a chance to do that. So make sure you're on our newsletter, which is just the cityhealthdashboard.com/subscribe, where we'll be announcing that, and it'll probably be on our site and everything too. But in general, for smaller cities, you know, being able to access the census measures and these other health measures that are from all different data sets, you know, the way that we curate and compile that data onto the dashboard, we hope is really valuable. And so that just like, you know, the big cities like Chicago that can access that data, they have their own data analysts and can pull it from those different data sources. Smaller cities on the dashboard are able to do that too. And there were a few other questions that came through the chat that were answered there, but just to kind of draw attention, the full metrics list is available on our About page, and I provided a direct link to that, answering some questions about how to cite the dashboard. We really welcome people using the data in research and in reports that you're doing, community health assessments, all of that. And so we provide an easy citation for the data. Just looking if there's any other questions. think we answered everything, but any other questions, feel free again to put in the chat or just come off mute and ask.
This is Tom. I have one more question. Do you have any examples of scripts API that we could look at to follow?
API scripts, that's a good question. Put that in your email to us.
Okay,
and,
will do.
and we'll see if we can help you there too.
Great, thank you.
Mhm. Okay, we'll hang out for another minute or two if there's additional questions and the asker is just looking for a smaller crowd to ask us. But otherwise, here's where you can find us in all different places. And please do be in touch. The info@cityhealthdashboard.com email address looks kind of generic, but it goes right to Sammy and she will direct you to the people on the team that can help you. So please feel free to reach out, and we look forward to being in touch, and we hope the data is useful.
Okay, I think mostly who's here is just dashboard staff, so I will end the meeting. Unless anyone else has any last questions, I will. Okay, thanks everyone for joining us this month.
Thanks, Sammy.
Bye, see you next month.